Hello, everyone. This is the David Goodman Reality and Truth Show. Thank you guys so much for tuning in. My name is Vanita Lambert, and I have a very special guest with me today, Mr. Al Ficini. We're going to be giving out some really great information that you guys are probably going to want to get your pen and your pad ready to take down some dates and some information. And you can also follow us on YouTube, so you can watch it over and over again. But before I get into my program, we live in a COVID world, so I always just have to talk to you a little bit about COVID and just some personal things. It's just my personal opinion. You have the choice and the right to do whatever you want, but my personal opinion, the way I see things right now is that at first, when this virus first came, it was affecting all of the boomers, all of the older people were getting sick and everything. Now that most of us boomers, and I'm a boomer too, are vaccinated, it seems to be now affecting a lot of children that are not eligible to get the vaccine.
Yes.
I heard, and I listen to news, I watch all the news stations, CNN, Fox, MSNBC, I'm an avid news watcher, and thousands of kids are getting sick, and that scares me. So I'm just going to ask everybody to do your part, do whatever you can to help protect our children. It's not just about you, it's not just about me, it's about our children. And I think it's very, very important that we take whatever action we can as an individual to make sure that they're safe, whether it's a vaccine, a mask, or whatever it is, keeping your kids home, whatever. So, on that note, I just want to thank Al Ficini for coming on our show. He's really my boss, but he's like a regional man. I call him my boss.
No, it's the other way around. No.
But he is a Medicare expert. And we're in the people business. We want to make sure that everybody has all of the information possible. And we sit down with 10 to 15 families per week, and we talk to them about the 4 areas that will impact their lives the most. The first one being Medicare. And there's just so much confusion about Medicare. So we want to try to set the record straight a little bit and just give you some detailed information about the A, B, C, and D's of Medicare, especially Medicare Advantage plans.
Yes.
So, there's just so much confusion out there, Al. I sit down with people, just trying to know the difference between Medicare, the Medicare Savings Program, and Medicaid is a complete puzzle.
Totally agree. I totally agree. Yeah, and our government has given us so many choices that people are overwhelmed, and what might be the best plan for their next door neighbor could be the worst plan for them. There's too many choices. First of all, how to sign up for Medicare when you turn 65. How do I do it? Where do I start at A? And then, do I stay on original Medicare? Do I go on private Medicare? If I stay on original Medicare, well, I have to get a supplemental. I have to pick one of the 24 different prescription drug plans. If I go on to private Medicare, I go on HMOs, PPOs, point of service plans. Oh my God, and there's so many different choices.
There is.
And picking the wrong plan can hurt you. Paying too much for drugs can hurt you. So, and I think that's what our expertise. So me and Vanita work together. And we just, we start here. We literally deal with all the plans in the state of Connecticut,
Yep.
and we sift through all the plans. And, we take it down to the plan that's perfect for you based upon your situation. And I think that's the hardest part. And, there's 2 new carriers coming into the state of Connecticut next year in 2022. It's going to add more confusion. But I'm incredibly excited in the sense that the benefits are getting so much better for
Yes.
our clients and our individuals that are over 65. There's going to be plans next year that are going to have 0 copay for people on the
Yep.
Medicare Savings Program. They're not going to pay any copays at all. There's going to be plans next year with unlimited dental benefits. So I'm just incredibly excited. And then I think the other biggest challenge is understanding the Medicare Savings Program in the state of Connecticut. There's so many individuals that get that information wrong or have no idea that it exists. And it's been such a a godsend for so many of our clients because number one, they can get rid of their Part B premium and the state of Connecticut would pay for it. They can get their prescription drug costs paid for, and they can get their co-pays taken care of. And it's so confusing when you apply for the Medicare Savings Program. If you put down the wrong information, the state of Connecticut, when you apply, will accept that information. Like when someone's still working, not all their income counts towards the Medicare Savings Program, but yet if they put down the wrong information, their full salary, they're going to count the whole thing. So that's the biggest challenge. Dealing with an expert, I really feel in my heart and soul that makes the difference, all the difference in the world. Having someone to turn to when you have a question, having someone to help you fill out the application. We save people many thousands of dollars a year just helping them pick out the right plan.
That's right.
And stop me, Vanita, if I'm talking too much.
No, you're not. Keep going. This is it.
And there's many different levels for the Medicare Savings Program. You have QMB, SLMB, ALMB, and getting the wrong information will hurt you. I guess that's my biggest message. I hate to say it because I age myself. I've been in the financial service business since 1985. And in 1995, I exclusively started focusing in on the retirement market, helping individuals that are 65 and over, or people that get on Medicare, or people prior to retirement, because I feel it's an underserved marketplace. Technology has left a lot of my clients behind. And the things that we take for granted that we go on Google, some of my 80-year-old and 90-year-old clients have the inability to do that, even though more and more are able to do that now. And then even if they have a mastery of the internet, the biggest challenge is all the moving parts. Moving parts to retirement planning. Very rarely do we find people that are all set. And if they are all set, we'll be glad to tell you that, But dealing with an expert is crucial and essential. Crucial. That can sift through the information. And then the amount of information that's being mailed to you is overwhelming. You sit with a client that's turning 65 or during annual election period, and they're bombarded with information. And a lot of times, some of the information could be misleading. They think they're calling Medicare, or this is a Medicare request, and it's not. It's a solicitation. And, again, getting the right information is crucial.
That's the most important thing is sitting down with a licensed professional and understanding what your needs are. So I take a lot of pride in sitting down with folks because I customize a plan. Like you said before, what works for your neighbor may not work for you. Yeah. So I sit down and I ask the questions. What medications are you taking? Are you seeing any specialists? All these little things makes the world of difference.
That's right.
And once I'm sorry.
No, you're right.
Once we get that information, when I ask you the questions and you give me the answers, you're basically telling me which plan to recommend for you. And being an independent broker, it's important to know that I'm not going to try to squeeze you into one plan because I work for one company. I work for you, and I have a plethora of different life insurance companies, Medicare companies, so I pick the plan that's best for you. And it may not even be the same plan that's good for your husband. And it's important to know, I've sat down with clients that wasn't even sure what Medicare A was.
Sure.
So I explained Medicare A is for inpatient hospital. Medicare B is for, doctor visits, and, the Medicare Advantage plans is Part C. And then I explain what Part D is, because it's just those little things that everybody does not understand.
Sure. And I think what's also important, it's not just the Medicare aspect. Do you qualify for the Medicare Savings Program? It's a state of Connecticut and federal program where you get extra help on, first of all, getting rid of your Part B premium. I can't even tell you how many people did not realize that they qualify. That's what's shocking.
Yes.
They never had any idea how to qualify for the program. The state of Connecticut's not going to advertise the program. You need a financial expert or a Medicare expert that can help you and walk you through that process of how to fill out the application properly. Because again, they're looking for the net results. They're not looking for certain, if you take distributions out of your IRA, that income doesn't count unless you're doing required minimum distribution. If you're working, only 50% of your income counts. The first $60 a month doesn't count, and they only count 50%. All that information, if you put down your real salary,
you're done.
You're done.
You're done.
It's so sad. It's just so sad, people getting the wrong information. And that's what we pride ourselves on, knowing every plan that's available in the state of Connecticut, knowing every prescription drug plan in the state of Connecticut, just being that expert, that can walk them through it. That's so important. And like I said, the Medicare Savings Program, we are so blessed in the state of Connecticut. We have probably, I don't want to say, you could earn a tremendous amount of money in the state of Connecticut and still qualify. And assets don't count. That's what's so interesting. You could have an unlimited amount of assets. They're not looking at your assets. So you don't take it for granted that you're not going to qualify. I can't tell you how many people that I've seen in my life that qualify.
Yeah, that's so true. Just get the information.
Yes.
If you think you're already all set, just confirm it. Get the information. I can't tell you how many times I sat down with folks and put them on the Medicare Savings Program, and they had assets. They thought if they owned a house or had a 401k that they did not qualify for the Medicare Savings Program. The Medicare Savings Program is based on your gross monthly income. You're allowed to have assets. Medicaid, you are not. That's where it's the biggest misconception out there. And I've gone into homes and saved the Part B premium for a husband and wife. So that's putting almost $300 back into their pockets, plus co-pays, plus deductibles, a month, exactly, a month. And, it just feels really good to help folks like that. That's what we do. You would have thought I saved the money. I was so happy. Sure. And, put them on zero premium plans and just kind of help people out.
So literally their Medicare and their co-pays are free. They're literally getting 100% coverage for free, which is absolutely amazing. And you can earn a substantial income and still qualify. And again, those 3 different levels. And what's amazing is the state of Connecticut doesn't recover. So when you pass away, they're not going to go after your assets as it pertains to anything that they covered the Medicare Savings Program. So it's the most incredible program. Connecticut, people talk bad about Connecticut. We are an expensive state to live in, but also some of the services that the state of Connecticut provide, I think, are second to none compared to other states. And a lot of individuals don't realize we do pay a lot of taxes. Housing is definitely more expensive in the state of Connecticut than most. But we do have a tremendous amount of programs in the state that make it easier for retirees or people that are on Medicare.
That's right.
And you hear bad mouthing, and we are lucky in a lot of instances to be in the state of Connecticut.
We are so blessed. I'm going to tell you this. I recently got appointed. I'm licensed in the state of North Carolina and Maryland, and I have a client in Maryland that lives in Baltimore County. They do not have a Medicare Advantage plan in that county that I can find. Yet, I'm still looking, but I spent weeks looking, and I searched under one of my carriers, which, shall remain nameless, but I have 2 others, but I couldn't find a Medicare Advantage plan in the whole Baltimore County, which is, we have Medicare Advantage plans, multiple plans in every single county in Connecticut. It's
by
just
every carrier.
Unbelievable.
The amount of plans that we have in Connecticut. I don't know of any other state that has as many plans as we do in the state of Connecticut. So it can be custom tailored based upon your situation. And that's why it's so important to deal with an expert. Don't assume that the plan you had that served you last year is going to be the best plan the next year, because your prescription drugs change, the formularies change, the companies change the plan. So don't assume. You really, when you're in the Medicare world, it's so important to shop every year and look at it every year. And those are the services that we provide for our clientele, is just to make sure they're on the best plan based upon their situation. And we want to be there when their situation changes, because your health today is not going to be your health tomorrow. And that's some of the challenges, as we age, and we're going to be there for them every step of the way. And a couple of other misconceptions is you're not able to change all year long. You are. Depending on your situation, there are opportunities to make changes. You know, if you have the Great Connect card, if you're on Medicaid, you can make changes all year long. If you're on a supplemental plan, you have the ability to make changes. And that's another thing that's confusing, that I just have to do it during annual election period, which is, you know, October 15th to December 7th. That's not the case at all. So if your health situation changes, call Vanita. If your prescription drug changes or something's not covered by your formulary, call Vanita. We're here to assist. If you think, if you want to understand the Medicare Savings Program in the state of Connecticut. And again, it's a state of Connecticut program, but we assist you in understanding how to fill out the application. Call Vanita. You know, I just can't stress it enough. You know, we're just so passionate. We're here at Flagship and American Senior Benefits. Our tagline even says, putting people back in the people business. We're here to serve, and I think that's why I've been in the financial service business for 36 years, and I still love what I do, because we serve and we make a difference.
And we make a difference in people's lives. That's why, we like it. We're like public servants, call me for all the free information. I will drive to your home anywhere in Connecticut, sit at your kitchen table, or
virtual in our office.
Yes, we have 2 offices. We have an office in Farmington. We have an office in Shelton. There's another office in West Haven. It's my house.
That's right.
I've had clients come to my home, because sometimes it's just inconvenient. You may live with a bunch of people, and, some things are just personal, and you might need that privacy. So call me and I will sit down with you and give you all this information for free. Another thing that I want to mention that you really need to be aware of, if you are on a Medicare Advantage plan, you have to be aware of the annual change notices. Sometimes they'll mail you a booklet. It might look like junk mail. You could throw it out, and you could be losing your dental, your vision, your hearing. Yeah. It's happened before. So
co-pays are changing.
Exactly.
Something's changing in that.
Something changes
and
every year.
A lot of times too thick that you get overwhelmed.
Nobody's going to read all that, and that's why it's it's important to me to sit down or to at least make contact with my clients at least once a year and give them the opportunity to ask me questions or set up an appointment and review something, because things are constantly changing
and getting better in a lot of instances, or other carriers are trying to be more competitive.
Yes.
So you're seeing unlimited dental next year, which blows me away. Blows me away.
Yes.
And with a new carrier that's entering the state of Connecticut, we're always going to be on top of every change that takes place in the state of Connecticut. And I think that's so important. Where are you going to get that information? And I think I don't think, and I know that that's what differentiates us. A lot of people just dabble in retirement planning. This is all we do. This is our focus. And we do so many other things too.
Yes.
We're focusing on Medicare. And I'll just touch on that when you get a second, when you want me to.
Yeah.
I'll talk about
we may have a second segment to do nothing but retirement income.
Yes, yeah.
Yeah.
We really, all our clients have four major concerns that they lose sleep over. Number one is Medicare, making sure that they're on the best plan, making sure they're not paying too much, and making sure that as their situation changes, they have the ability to change as their health changes. But, so many of our clients are worried about running out of money. Oof. And we have the ability to support that. We have 14 registered investment advisors in our practice that assist in reviewing financial statements, mutual funds, 401ks, and putting together a plan to making sure that your money will last as long as you do. And I've seen it happen where clients run out of money, It's so important to have the right asset mix based upon your risk tolerance. The number one reason why a portfolio performs is not based upon stock picking or market timing. It's on proper allocation, having the right stocks, bonds, CDs, money market accounts based upon your risk tolerance. That's what's crucial.
Yep.
And then, another big issue that retirees face as they age if you live a long life, you will become chronically ill before you pass away. And the state of Connecticut has some great programs. We have a Medicaid home care program, which when you need help with your activities of daily living, you can get help in your home. You can get a home health aid. You know, people think chronic illnesses will end up in a nursing home. Absolutely not. You know, we have programs in the state of Connecticut that will cover home care, and it could be round-the-clock home care. And dealing with a professional like Vanita, making sure that you understand that program and how to qualify. And you don't have to be destitute to qualify for the home care program, or even when someone does need institutional care, that surviving spouse is terrified, I'm going to lose everything. Absolutely not. There are ways to protect all your assets, even if you did no planning, as long as you have the proper documents in place. And that's another thing that I see so often. People don't have power of attorneys on their wives or husband. Making sure that you have health care directives. Making sure that you have someone that can act on your behalf should something go wrong. Because if you do not, the state will appoint a conservator. And if the state appoints a conservator, now everything has to go through the probate court. And protecting assets becomes so much more difficult. So having your affairs in order, so again, you know, starting off with the Medicare and health care, starting off with, you know, outliving your income, and then lastly becoming, you know, as you age, you will become chronically ill, and we know exactly what to do. You know, it's so interesting. I always said, if we had 100 financial advisors in a room, none of them will know what to do to protect assets like we do. We've made it our focus because because I've been doing this so long, and my clients are aging. You know, I have clients in their 90s, and you know they're faced with chronic illnesses, and we made it our passion to make sure that they don't have to spend down all their assets to qualify for certain programs. Like if they need institutional care, we're not leaving the surviving spouse destitute. There's ways to do planning where the spouse literally doesn't have to spend on any of the assets. Just understanding the system, getting the right information, dealing with experts that have the right elder law attorneys to turn to is so crucial. I can't stress it. So crucial and essential.
Yes, it is.
And then lastly, making sure that a surviving spouse, when a premature death takes place in a household, when the spouse passes away, they don't become destitute. Exactly. Because a lot of times incomes go down substantially. You're going to lose the lowest Social Security. Pensions might be eliminated depending on their situation. And just making sure that doesn't take place where that surviving spouse doesn't become destitute. So we do an awful lot of planning around that. Those are really the four things that affect individuals. And I love what we do because we have everything at our disposal. There's nothing we can't do. There's nothing there's no situation where we can't help. And I think, again, that's my driving force, that's your driving force, that's our organization's driving force.
Exactly. We, cover everything full circle. I mean, it says it in our company name, American Senior Benefits. We make sure that you're covered from Medicare to home and auto insurance. There's nothing we leave out. So it's just so important to sit down and just begin to make a list, even something as simple as a will. And, just to mention something like that. You want to get your wills in order, what's important to you, what you're going to spend on Medicare. It just goes on and on. So, this is my passion. This show, I'm talking about Medicare is what I love. Sitting with people is what I love to do. And we have about 2 minutes left. So I'm going to leave the last 2 minutes of the show to Al Ficini, our professional. What message do you want to leave our clients, our audience, regarding Medicare and retirement?
Well, what I really find is I don't find anyone that's all set. The amount of people that don't have wills, the amount of people that aren't prepared because they put it off because it's negative, and it's not. We make the whole process interactive, and we try to understand what you're trying to accomplish. you know, and I really feel, if not now, when? You know, not now, when? You know, COVID, making sure you have
Exactly.
powers
Oh,
of
my
attorney,
God.
you're able to act on your spouse's behalf is more important than ever. Making sure that the checklist is done and we make it where it's not overwhelming, you know.
Exactly.
You know, and then we're able to assist you in every aspect of retirement planning. I can assure you one thing, that even if you never do business with us, it'll be educational. You'll understand what you need to do in the future. Just having that understanding, and when you're ready to make that next step, we're going to be there for you. And you know, and I think you're never going to, not never, you'll get the right information, and I think we're the organization to really support that and make a difference.
I agree.
You know,
I agree
I'm not going to
so
tell you
much.
that nobody else does what we do, but I'm going to tell you
I don't think
that-
they do.
You're
I
right.
really don't. I haven't found anyone that does what we do. I mean, if not us, then who?
I totally
Get
agree
the
with that.
information. Get the information. Al, I want to thank you so much for being on the show.
Benita.
It's been a real education. Every time I talk to him, even though I'm in the business, I still learn stuff over and over and over again. Hearing it over and over again just kind of cements it in my brain, and I'm able to bring that to my clients,
And
and
I love your
appreciate
passion.
that.
I truly love your passion. I love it. I enjoy it so much. I enjoy being around you because you're so energetic and so passionate about what you do. And,
Thank you.
And I appreciate you so much.
And I thank you for all your support. He supports me in everything that I do. So listen, thank you so much for joining us. This is the David Goodman Reality and Truth Show, and we're on your side.